confused.
That's right.
My son was 20 years old when he was prescribed opioids.
I think I was 16 years old. I must have gotten a 30-day script. I took them all in 3 days.
A car ran a stop sign and completely T-boned us.
Nothing mattered more than getting my fix.
I was given a prescription opioid pain medication, and within only a few months, I was completely addicted.
My brother RJ had me believe that he knew exactly what he was taking.
My son Steve did not want to die, but his prescription opioids killed him.
It's likely that everybody knows somebody who is struggling with this very problem.
I was stealing from people, buying substances on the street, and I look back at that time with a lot of shame. You know, that's not who I am.
I want people to know that these drugs are addictive, and one pill can equal death.
There was nobody to tell me that these have a really high potential for addiction.
My son overdosed at the age of 22 years old.
We lost RJ at 32 to prescription opioid overdose.
You never expect that you're going to lose a child. It's all out of order.
My dad took one pill too many that ultimately killed him.
It just takes one.
Okay, well, probably a change of pace from the previous panels that we've had today. I want to start by thanking you. As Michael said, I'm now a return employee of the Heritage Foundation. And when I left HHS, people said, are you going to go back to Heritage? Like kind of questioning why I would do that. Why do you want to go back? And I said, because it's home. And because I really believe in the mission of what Heritage does. And I thank you all for letting us do what we love to do and really to help us to take the conservative message to the country. So thank you so much for the opportunity to be back at Heritage. So as Michael pointed out, I was a senior counselor in the Office of the Secretary. And in that capacity, our jobs were as senior counselors to jumpstart the presidential and secretary initiatives for the new administration. I was part of the transition team, the landing team that went into the agencies to meet with people after President Trump was elected. And then I stayed on in January with the beachhead team to kind of bring on the new team. And then when the secretary asked if I would stay on, and I said I sure would, and I'm here to serve, and he handed me the opioid issue, and I said, well, I don't know much about it. He says, he goes, but I know you can figure it out. So I learned a lot in the year that I was there, and I want to kind of share some of the perspective that I had, and Paul has some as well, and then hopefully have a good discussion. So a hard issue. I will say I've come home many a nights crying to my husband saying, this is really hard. It's very human and very personal, and it's a difficult topic to solve. It's not like saying we're going to fix Social Security or Medicare, that's for sure. But a couple of things. I think the CDC has done a very good job, and one of the things I learned in how they've described it is it's actually not as simple as people think. It's actually been a process, like a wave, this challenge that we face. And I think this ad campaign shows what they call the first wave, which is the issue that we've had with overprescribing of prescription opioid medication. So in 2008, they said that there were, of overdose deaths, there were about 2,000 people who died related to a prescription opioid overdose. And then in 2008, that skyrocketed to almost 9,000 people who had overdoses. Then the next wave they talk about is starting in 2010, which is in heroin. And they look at the rise in heroin addiction, also in opioid. So in heroin, in 2008, there was about 2,000 people who were, had an overdose related to heroin. By 2010, that number went up to about 4,000 people who had died of a heroin overdose. Now, fast forward to what we call the third wave, and what I think Paul and I agree is probably the most dangerous wave that we have. And oh, I'm in charge of the charts. Is the issue of illicit drug overdoses. So people talk a lot about the number of people who have died of overdoses. So you hear the number 60,000 people in 2016 died of a drug overdose. That's important to note that that's drug overdose. That's not explicitly opioids. But of that 60,000, about 2/3 of them are related to some form of opioid. So when you look at this last wave, and probably the most dangerous is the synthetic opioid death rate that's increasing. We know that about 30% of the deaths related to illicit drugs, 30% of deaths are related to that. And of that, almost 45% have some form of opioid related. So we have now, and now we're in 2016. So you look at the prescription drug situation, that things are somewhat getting under control. We have great ad campaigns that the government is even putting out. Prescribing rates among providers is starting to slow. The heroin issue, that's also complicated, a very illicit drug that's being used. But the biggest danger that I see moving forward is this question of the illicit drugs, and the illicit drugs that are laced with opioids, in particular fentanyl and carfentanil. This is an example of what a lethal dose mixed in any type of a drug could be. So if you're taking an illicit drug, whether it's recently the story of Prince that came out, what did he actually die of? Well, he was taking what he thought was a Vicodin that was actually laced with fentanyl. The fentanyl is what killed him. So in his mind, he thought he was taking probably a Vicodin. I maybe shouldn't use his example, but let's take a hypothetical. You think you're taking a Vicodin, you're buying it illicitly, meaning it's not from your CVS, your pharmacist isn't handing it to you, you're taking it, but it's been laced with fentanyl. So when you look at the heroin, the amount of heroin that needs to be combined with whatever the substance is, which is lethal, look at how little it takes in fentanyl. I think that's probably one of the biggest takeaways that I took from this job, which is our danger is this. That fentanyl can get mixed in a variety of products. We knew recently that I read that there are new news reports that the amount of cocaine coming in from Mexico is increased. It is now at the highest it's been since 2007. There's no reason why cocaine can't be laced with fentanyl. People are mixing these drugs together. So we have a multi-moving, fast-changing crisis on our hands. And it takes us a lot to kind of think and take pause about how we're going to solve it. Some of the takeaways I had from a policy perspective is we did two things when I was at HHS. The first really was a lot of external meetings. So regular people who've been involved, providers, insurers, here's what we're doing. But we also went on the road and met with everyday people. I was in Maine, I was in Pennsylvania, I was in Ohio, New Hampshire. There were a lot of other places that have been traveled. You'd have roundtables at the state level. And you'd hear from everyday people sitting around the table telling you tragic stories, some positive, but still tragic in the sense of lives changed forever. So a lot of external work of hearing real-life people, and real-life heroes as well, who are trying to do things on the front lines. And in those meetings, the thing that I've took away very quickly is this is not a problem that the federal government has a solution for. So similar to what I said, this isn't something that we can just create some sort of a diagram and say, here, this is how we solve it, and the government's going to pass a bill that solves this. It's going to take a lot more. And it really is going to take the people on the front lines. This is a real local problem that's happening across our country. People on the front lines, law enforcement, first responders, nonprofit organizations, faith-based community leaders. And as we were talking earlier, we were saying, even you and I, this Saturday is the Take-Back Day for drugs, for illicit prescription drugs, where people in America can take the prescription drugs that are unused and dispose of them. Because believe it or not, there are rules on how you can dispose of drugs. Mainly because some of them are really potent and very dangerous, and you can't just throw them in your trash can. It's a good lesson for us that when you open those cabinets, having one of these drugs, these are controlled substances. These are not like having penicillin or aspirin sitting in your cabinet. These are drugs that are very potent and they're controlled. They're not the kind of drugs that you're seeing behind the CVS counter. These are very potent drugs and we need to take them seriously. So even as individuals, we have a lot we can do. What do I see the states' role in this? I see the states as really conveners. And by the way, when I say what I see, this is what's happening organically. This isn't laws being passed telling people how to act. This is what we're seeing on the ground. The states, I think, are great conveners. Not only do they convene across, from the local level, hearing what's happening at the local level, trying to figure out how to get resources, whether it's law enforcement, data, et cetera. but also a great convener to the federal government. Here are our needs at the state level. Here's what we could need. Is it better information from CDC? What are best practices? What do we need in there? So great conveners, and great conveners across the states. So when you have pockets, if you're in the Northeast, so Maine, New Hampshire working with Massachusetts, that's what I see a lot of happening at the state level. And what's the federal role? Well, funding is obviously part of it. That's been part of the crisis solution that we've had. Federal programs, making sure that the federal programs themselves are compliant with what we want best practices to be. If we don't practice them in the federal programs, then how can we expect others to do the right thing within their programs? Regulations. And I think the other area that's been, I think, very impressive with this administration is the bully pulpit. I think the president's been very courageous to talk about this issue. It's complicated, it's messy. Again, it's not something that you're going to say, we have victory tomorrow, but it is something that we need to gain national attention on. So there are a lot of areas that I think that play an important role moving forward. So what do we see moving ahead in general? Well, first of all, believe it or not, there's a lot that's already been done. That we're just, the small things that happen that maybe don't get national press on the front page of the New York Times or USA Today, but there is a lot that's being done. And I think partially it's because it's not a partisan issue. There really should not be, I think, in this discussion about whether it's a Republican or Democrat solution. It's really an American solution. How do we come together as civil society and a community to work together to solve these problems? But there has been a lot done. Even in 2016, Congress passed two major pieces of legislation, the Comprehensive Recovery and Addiction Act, the CARA bill, as well as the 21st Century Cures Act. Both had very large programs for either targeted assistance to the states or general funding to the states to help out. Part of my job, though, in my first year in the administration was making sure those programs got up and running. Just because, and this is a great lesson, just because Congress passes something doesn't mean that money goes out the door that quickly. I look at it very similar to like a natural disaster. When you see a short-term fix, and then what's the long-term fix going to be? So when you had the hurricanes that came through Puerto Rico, we're still handing out money through FEMA. But it's a longer-term process. But what we need is short-term, quick reaction things that are going to help in the immediate, removing barriers, removing regulatory obstacles, and then having a longer-term plan. We do see the administration, I think, has carved out a very nice and kind of concise approach to it, looking not only on education, how do we bring public awareness to this, how do we change practices, the supply side, which is the dangerous piece when it comes to illicit drugs, how do we stop the supply of these illicit drugs coming into our country, and then focusing on the treatment and recovery for those who have gotten trapped into this horrible disease, how do we move them into being productive citizens into the country. So that's kind of the three, and we expect, I think, Congress in the next couple weeks is packaging up a new set of proposals and bills that'll be coming to the president's desk. I think that will be another good flow, but it's not, I always caution people that the federal solution is not the solutions that's going to fix it. It can provide support. It can provide opportunities for states to do the practices that they need, but it's not going to be a big bill that's going to solve it, that we can say we passed it, now we can claim victory. It's going to be a long road ahead, and I think the danger that we have is it's moving so fast that we need to make sure that we're allowing those and the front lines in particular the ability to address it as quickly as possible without any interference that the government might create slow barriers like we hear in other natural disasters. But with that, I guess I'll turn it over to Paul and let him talk about his insights into this as well.
Let me echo what Nina said at the outset and say, first, I'm honored to be here to give you the benefit of my thoughts on this subject. But more importantly, I want to say thank you. Thank you not only for all the support that you've given Heritage over these years, but thank you for caring about the sorts of issues that Heritage gets involved in. If you care about it in your community, you're an example for others. If you get involved in these issues in your community, you're an example for others, whether they're in your family or elsewhere. What you are interested in and what you do matters. And if you didn't do what you do, I wouldn't be here to be able to offer you my opinions on this problem. So At the outset, let me say thank you for everything you've done and for the opportunity to be here. I guess you could say my first experience with the criminal justice system was either genetic or environmental, since I grew up in a family in law enforcement in New York City. I had two uncles on the NYPD, a cousin who was a treasury agent, my father was an investigator for the state. So it could have been genetic, it could have been environment, it could have been both, didn't matter. I got exposed to it early. And my earliest exposure to the drug problem happened also in New York City. When I was growing up, the French Connection wasn't a movie, it was a reality. All that was coming in. I remember one of my uncles telling me that unless you had a truckload of marijuana, we're not interested. We have too many problems dealing with heroin in New York City that we just don't have the time to deal with other things. You know, at one point, 2 out of every 3 heroin addicts in the United States lived in New York City. That was the problem that they were focused on in this area. So for them, you know, they got an early appreciation, unfortunately, of what a lot of the rest of the country is now seeing. So most of my career has been involved in one form or another in the criminal justice system. For example, I was at the Justice Department for about a decade. I started out in the organized crime and racketeering section of the criminal division. I then went to the Office of the Solicitor General. I had the chance to serve in the Justice Department when Ed Meese was the Attorney General, as well as one of his predecessors and successors. But I've also been a federal agent, and I left as special agent in charge. I worked for Senator Orrin Hatch when he was the chair of the Senate Judiciary Committee. I was the head of the crime unit. So for most of my career, that has been you know, a very important part of the scholarship and work I've done. But more recently, I started focusing very much on drug policy, in part because I was writing a paper about a program, or 2 programs, that in this area I'm going to talk about, called the Hawaii Opportunity Probation with Enforcement Program, or 24/7 sobriety, that showed me there's a different way of looking at this sort of problem that is, I think, a very valuable way of trying to deal with this. But let me back up a little and say, if I can play with this, right?
Mm-hmm. Green is back.
Whoop.
Green. I mean, red is back.
You know, I've got a light on my VC DVR at home still flashing because I don't know how those things work. But the outline. Okay. Let me tell you what I'm going to talk about, and then we'll go through it. First, what is the problem? Second, what are the approaches that people can take, society can take, America should take to this sort of problem? What has the Trump administration said it's going to do? And then, as I learned when I had kids, I have to give you a goodie bag, so I'm going to recommend some things if you're interested for further reading. One of them, in fact, would make a great stocking stuffer because it's a book that won't come out till around Christmas. Okay? The problem. As Nina said, and as you can see, there has been an awful trajectory dealing with opioids and dealing with overdoses. 60,000 people in 2016. For what I read recently, there may be between 60 and 70 in 2017. That's more than we lost in the entire Vietnam War. And if it's 70,000, it's close to twice as many as we lost in Vietnam. That's a lot of Americans, and that's a serious problem no matter what's causing it. And whether you look at it from a moral perspective, a utilitarian perspective, a purely humanitarian perspective, if we're losing that many people to something that's preventable, we got to figure out how to prevent it. So that raises the question then, what is causing it? And as Nina said, there are different stages of this problem. We no longer are in the stage where people who have surgery or in a terrible automobile accident are getting prescription opioids. That's running out, so they're going out and buying heroin. Heroin's laced with fentanyl. That's happening. But only 4% of the people who get prescription opioids because of surgery and the like are now winding up overdosing from it. Heroin has replaced OxyContin as a big problem. And as Nina said, fentanyl is oftentimes used in connection with heroin. Why? It costs about $35,000 to $40,000 for a kilo of heroin. It costs about $8,000 to $9,000 for a kilo of fentanyl. So do the math. You're going to cut it with something, and you could even sometimes advertise this will give you an even better kick than the normal heroin. And it's being sold. Fentanyl is about 50 to 100 times more powerful than morphine. Carfentanil is about 50 to 100 times more powerful than fentanyl. Carfentanil is used as a tranquilizer on elephants. Okay? It's not something you would likely get a doctor to prescribe after surgery or for an injury. Fentanyl, yes. In fact, after surgery, I had fentanyl prescribed. But it's not something you're going to be taking on your own, and certainly not something you want to buy on the street. As Nina pointed out to you, a minuscule amount of that can just stop that part of your brainstem that governs respiration. I mean, there are stories, police have found people with the needle in their arm only half empty because they wound up with fentanyl or one of its analogs that killed them. So, yes, it's a, opioids are a problem, but it's not the type of problem that it was before. It has moved on into these other stages. Plus, there is a terrible polydrug problem. You don't have people just using opioids from surgery and then going on to these other things. A large number of the people who are overdosing sometimes with cocaine laced with fentanyl. Or they take cocaine and alcohol and heroin. There are a very large number of overdoses these days from people who are combining drugs. And oftentimes it's because they started earlier on. So that this, as you see right here, is part of it. We're talking about the problem of whether it's abuse of legal drugs versus illegal drugs, whether it's opioids or heroin or fentanyl. Nina pointed out that we have gone through stages in this, and we are now in a stage that's different from the one it was initially. And in order to address this problem, you have to know where we are in this development of the problem. And that's where we are. As she pointed out, what we thought the problem might have been in 2008 is not where we are now 10 years later. Okay? So, if you, let's see, I think, yep. There's a range of approaches to this problem, and I'll lay them out for you going, pun intended, I guess, from left to right. The first spectrum is complete laissez-faire. One option to deal with this is just say, as long as you tell people what they're getting, let them buy and use whatever they want. Mm-hmm. That's one end. I don't think anybody would expect Congress or state or local legislatures to adopt that program, even if the state and locals could. But nonetheless, I don't think anybody does. But it is out there, and there are people that argue one way of dealing with this problem is just let people buy whatever they want and make sure they're told what it is they're buying. Because then you won't have people buying things that are laced with fentanyl if what they're doing is looking for something else. So that is one possibility. Now, it's not likely for a host of reasons to be a very popular one because it's very easy to think of exceptions. For example, minors, a classic example, or regulations. You might want to make sure that the drugs that are being sold are not adulterated. Okay? So the next point on the spectrum is what I've called controlled or regulated legalization. You would not allow minors to use these drugs. You would not allow people in public safety positions like police officers, first responders, etc., physicians or pilots. Not very many people, if you've flown in here, would likely have gotten on the plane if you saw the pilot doing a line before he decided to get to the cockpit. So you can keep certain people from doing it, and then you can regulate how it's done, quality controls and the like, along the lines of what the Food and Drug Administration does with prescription pharmaceuticals. Okay? Then a next one is an educational, social, or medical approach, where what you focus on are things like prevention and treatment. Prevention is critical. The numbers are dramatic. If you have not used alcohol, tobacco, nicotine, or marijuana before age 21, the likelihood that you're going to go on and use them later is very small compared to the people who have used it earlier. And that's not just me saying it, that's Dr. Bob DuPont. He was the second drug czar before they had that term, and was the first head of the National Institute on Drug Abuse. And as a spoiler alert, he's got a book coming out later this year entitled Chemical Slavery, Understanding the Drug Epidemic. It should be forthcoming later in the year, and I'm reading it for him, and it is terrific. And it goes through all of this. And if I can't buy it all for you for Christmas, I recommend that you all take a look at it. But there are an important number of different treatment options as well, not just education. I'll tell you what I told my kids. I told my kids the problem with drugs is not that they're necessarily bad for you, is that they're too damn good. Okay? You start taking them, and you're going to feel good, and then you're going to want to forget about everything else except how you feel, and the drug then takes control over you. And that's kind of the problem that I know, my kids have told me, if you take the purely, they're all bad for you approach, they are bad for you, but not initially, you can lose some credibility. But that was the way I went about it. I think prevention is critical, but we have to be, upfront and say, yes, they're bad for you, but they're bad for you because they hijack your brain. The part of your brain, and there are several parts that are involved in pleasure, gets overwhelmed with dopamine, and it leads people to want to do nothing except get these drugs. And that's a terrible problem. Now, if somebody's gotten past that, and they've not only just used it, they've gotten addicted, there's treatment as an option. Now, one option is purely voluntary private treatment, okay, with no coercion involved whatsoever. The problem with that, though, is a purely voluntary drug treatment system is probably about as effective as a purely voluntary prison incarceration system, okay? You're not going to have a lot of people willing to stick it out because it's hard. I mean, it's very hard. And the problem we have is oftentimes people don't make it past 6, 8 weeks or whatever. You may need an entire year of treatment to get through this and then follow up. It's not like with a bacterial infection, you can kill it all off and then never have to worry about it coming back unless there is some new insult to the body. Your nervous system is going to remember how good this was, and if you're in certain circumstances, again, you're going to be tempted to do it. Quitting smoking, I found that out. When I tried to quit, it was hard. And then one time I did, and then I thought, for about 6, 9 months, I thought I could go back, just have 1 or 2. 2 or 3 days later, I was back to 2 packs a day. And then when I finally quit for good, one of the smartest decisions I've ever made, I ranked that up there with never buying a motorcycle, never trying to ski, and asking my wife to marry me. Correspondingly, her worst decision was saying yes. Okay? But you're going to be in a position in treatment where you're going to have to deal with this problem on a long-term basis. I remember after quitting smoking, I get up in the morning, I wanted a cigarette. I got downstairs, have a cup of coffee, I wanted a cigarette. I got in the car, I wanted a cigarette. Got to the office, I wanted a cigarette. The people who use heroin, cocaine, or whatever, they got the same problem, and it's probably worse. Mm-hmm. Nicotine addiction and heroin addiction are both very bad, but they're very different. The withdrawal is slower from nicotine, and therefore you could say more insidious. The withdrawal from heroin is like 3 weeks, or from any opiate, is like 3 weeks of the worst flu you can imagine. And there's only a limited number of ways the body can tell you it doesn't like what's going on, and they all happen at the same time. okay? So it's very bad. But there are ways of doing this that deal with this problem. I had someone ask me one time, well, should we just not administer Narcan or naloxone to people? And essentially in a caveat emptor sense. If you're going to use these drugs, take the risk. And I said no for a bunch of reasons, but I said, in one, think about how this would work. Or at least the person said, maybe the first time everybody gets it, but after that, no. I said, think about how this is going to work. You're a police officer or you're an EMT. You get called. You go see someone. This person is laid out on the street or in an apartment or a park or wherever. Okay? It's not like you can use facial recognition software and say, oh, this John or Jane Doe had Narcan 3 weeks ago or 4 weeks ago, and therefore they don't get the second one, requisite in pace. You can't put your reliance in a system that is going to be administered by people who don't have that sort of information. But what you can do is require that people who've had to have Narcan maybe once, maybe twice, however, you can use an arbitrary number, there's no one that's right, no one that's wrong, go through some sort of compulsory treatment. And the criminal justice system is very good at compulsory treatment, because if you don't do it, you got an option. Okay? The Hawaii Opportunity Probation with Enforcement Program that I mentioned before rests on the notion that the certainty and celerity of punishment is more important than the severity. You're on probation. You're going to get drug tested randomly, regularly, and frequently. And you're going to do it at the jail. So if you come in and you test hot, you don't get to leave. Now, it doesn't mean you're going to go to prison for the remainder of your term, 5 years, 10 years. First time, maybe 24 hours. Second time, 48, 72, etc. If you skip, it's a minimum of 2 weeks, because you're not allowed to thumb your nose at the system. But they found it works. Now, you also want to try to help people in this regard, getting them jobs and the like. And one little thing, a footnote, a slight diversion. I debated someone from the ACLU about a month ago at a law school in Ohio, and his position was, you should just give out heroin to everybody, it would solve this problem. They've done it in Switzerland, and therefore it'll work here. Okay? Think about this for a minute. The heroin high lasts 3 to 4 hours. If you're going to give free heroin to everybody, they're going to need to do it 3, 4, or more times a day. How can you hold a job if you're traveling back to wherever you're going to get the heroin to get it 3 or 4 times a day? That's one of the advantage of some of the other types of chemically assisted drug abuse forms that we have, like buprenorphine or methadone. Methadone lasts 24 hours. If you're on methadone, you take it at the facility, it's a liquid, you drink it, and then you don't have to come back till the next day. You can actually hold a job. Whereas if you're getting heroin for free, put the moral problems aside and all that. There are them, I understand, but you can't possibly be holding a job if you're spending all your time going back and forth to get your free heroin. Plus, if you're driving, after you've gotten it, you're high. If you're driving back to get it, you're beginning withdrawal. How many of you people want to have somebody like that driving a car on the road? Not me. So there are problems with it, but the criminal justice system does have the ability to coerce people to do things, and sometimes that's what works. Now, the last is just the total drug war. Forget about all these. Look at it just from the perspective of the criminal justice system, okay? We deal with it in the source countries. We deal with it at the border. We deal with it in the neighborhoods and the like, okay? That probably has been where we've put 2/3 of our efforts. But I think a lot of the new thinking is, while we need that, we need to add in treatment as well. And before treatment, we need to add more in prevention. Like I said, if you can keep somebody from starting with alcohol, nicotine, tobacco, or marijuana before 21, you're in a very good position that that person won't do it later on. So you want prevention. You want treatment for the people that fail, because there are people that will fail that will be able to succeed. Now, let me just tell you, here's part of the problem with treatment. This is America. Everybody wants success to happen right now. Instant gratification isn't fast enough, okay? Plus, there is a technological or a chemical solution to everything. It works immediately, it works the first time, and there's never any problem. First-time efforts to quit a nicotine addiction or a cocaine addiction can have as low as a 20% rate of success. We have to be willing to understand that we're not going to be able just to wave a wand and solve all these problems. It's going to require a lot of things, part of which is having true family support. I mean, you've seen the commercials. If you have dinner with your kids, the more often you have dinner with your kids, the less likely they are to use drugs. Yeah. And it's not just simply you're gathering intelligence on them by talking to them. It's although that happens too, when I was an agent, that got really good in that, in fact. But you're showing that you care. And that matters. Because it certainly matters if you don't. I think it was Denzel Washington when he was talking about the problem in black communities and the lack of fathers because of crime. He said, if a young boy doesn't have a father at home, he'll make the streets his father. And we know what happens then. This was Denzel saying this, not me. And in my experience, he's right. So that's the range. What the Trump administration has done is combine them. They want prevention. They want treatment. And yes, they're still going to have law enforcement. I mean, you all heard the hubbub when Attorney General Jeff Sessions came out with his plan, and part of it was, and the president too, part of it was the death penalty for drug traffickers who traffic in something that results in death. That was all over the media. It was a big deal. That wasn't news, folks, okay? If you sell drugs that contain, strychnine, arsenic, or whatever other poisons you can get out there in a white powder form and somebody takes it and dies, you could be charged with a capital crime now in whatever state you're in. So this is not like this is something new. So that was what they focused on, I think, because a lot of the media still suffers from Trump derangement syndrome. But I think you have to look at law enforcement as being an essential part of this problem. I think it's a mistake to say, no, we don't need law enforcement. I mean, for example, most fentanyl is manufactured in China and makes its way through Mexico or Canada, or believe it or not, the biggest distributor of drugs in the United States is the U.S. mail, because it gets sent in from elsewhere, and they just don't have the ability to go through and open packages, the millions and billions of them that are coming in. So they just keep sending it in because they figure, I don't know what their success rate is. They probably have people with MBA degrees trying to figure out what the success rate is of mailing things in, whether 75% gets them the most money or 90, whatever. But I think we need to have a variety of these different things. Now, in terms of taking things home, the best book I've read on heroin is now getting a little old, but it's by a law professor I had at Stanford, John Kaplan. It's The Hardest Drug, Heroin and Public Policy. And he goes through and addresses all the different arguments surrounding heroin. Should we have free legalization? Should the state subsidize it? What should we do? And he says there's a problem with everyone, and there's no perfect solution. His recommendation is that we try to use methadone. They didn't have buprenorphine back then. This is a 1983 publication. But read that because it'll talk all about heroin, and it'll tell you a whole lot of the policy arguments on each side, because that's what it is, a policy book. And then the National Academy of Sciences, Engineers, and Medicine came out with a report last year that's being read a great deal, entitled Pain Management and the Opioid Epidemic. It's a very long book, but it's a distinguished organization, so it's worth looking at. And finally, the book that I recommend everybody read is the Robert DuPont book, Chemical Slavery, Understanding the Drug Epidemic. It'll be out later this year. Like I said before, I've been reading it. It's terrific. And it'll tell you a lot of the problems. It'll go through the biochemistry of this and everything else. But let me end where I began. Thank you. I appreciate everything you've done for Heritage. I appreciate everything you've done, therefore, for me, and appreciate everything you've done for all those other people that we try to help. because without you, we couldn't help them. So thank you. And I'll answer any questions you have.
Hi, it's John Hajar from Boston. I happened to be watching the nightly news before going down for dinner last night, and I see that people are even abusing their pets, throwing their pets downstairs and doing all kinds of horrible acts just so the pets will be prescribed by their veterinarians pain medication. I mean, it was sickening to watch. It seems like that is on the upswing. Just a comment just happened to be
yes, if they abuse dogs, those definitely should get the death penalty.
I will point out one thing on that whole, I think it just underscores something that Ms. James was talking about yesterday, I think even Kim, which is there's a cultural problem happening. That's why this isn't a government solution. This is not a problem that government is going to come in and solve for all of us. There are discrete and important things government can do. Stopping the illicit drugs coming in through the internet. I mean, to be able to think that a 13-year-old can go on the black web, which I don't even really know what that is. I have a 10-year-old, I better figure it out quick, and order this stuff and have it shipped to your house. These are the things that, yes, there are important, proper federal roles. But when you turn on the TV and you hear on, normal television shows these days of people talking about, oh, don't worry, I'll just take a Xanax. Again, this is not aspirin we're talking about. This is not saying I'm going to go and get a Sudafed behind the counter because I'm having an allergy issue. There is a cultural shift here to think that if we just take some sort of drugs, things will just solve themselves, or we are, and maybe that's what the book is getting to. Do we have a dependence to solve our problems through some other form rather than getting at what's at the core? And that gets into the cultural side and what's happening to the family fabric and all these questions. So it's sad to hear, I mean, you hear these stories about a dog and all these things, and sometimes they're funny, but at the same time, you're like, what's happening to our country? What's happening to the people that they would think that that's okay to do?
No, I made a joke because...
I didn't mean that you were...
I know, because I make jokes. That's kind of my style. But you're absolutely right. That's happening. And to second what Nina said, it's an example of a problem we've had for the last 40 years. The problem is we have lost, as a nation, any notion that we have any duty to something other or greater than ourselves. It's an example of the problem that individual satisfaction is the summum bonum. Nothing matters as much as making yourself happy. If you have to injure somebody else or renege on obligations that you probably all feel we have as individuals to each other, not just to our family, but to the society and the nation, we have seen a progressive attempt to erode any notion that there is an obligation like that. And this is part of that problem. What you're giving up if you don't use drugs is the ability to get a short-term high from whatever drug you're using. And you are contributing to lots of other problems out there. And people now are often told you shouldn't make that trade-off. What you want and your own enjoyment and pleasure is more important than anything else. And this is an example of that. Someone who would hurt another individual or a pet to get medicine for the pet so that the person could then use it, that happens. You're absolutely right. It's sad. I'm just saying it's indicative of the larger problem that Nina talked about.
My question is about when is the swamp going to begin to be drained in Main Justice? And I base that upon my experience over 20, 25 years as a police officer, a state prosecutor right in this county here, U.S. attorney in Miami, and in over 35 instances while I was U.S. attorney, the Main Justice intervened and took over my cases in federal court because they said they were the experts. In none of those cases did Maine Justice ever get a guilty verdict out of it? And that's only for 30 cases out of maybe 20,000 that I handled and my assistants handled. And I'm concerned that the Justice Department may have a bunch of intellectuals, but they do not have the street experience of police officers and state and federal prosecutors who have to face these problems every day. And unfortunately, ever since the Eisenhower administration, the only solution has been, under Republicans, is not to replace people who die or retire from the Justice Department, and probably in the other departments as well. And I think we have to drain the swamp because of the size of the federal government is just unbelievable. And if they're not accomplishing anything, that's going to be our main enemy. Thank you.
I was at the Justice Department for about 10 years, and I think one of the biggest problems we have in the federal criminal justice system today is that we measure success using the same body count method that we did back during the Vietnam War. And one of the most important things we need to do is to figure out how we can measure success in the criminal justice system in a different way. Because what happens? You're in the budget time period now up on Capitol Hill. The people from the Justice Department in every agency, they go up there and they say, well, you gave us A dollars. We had B cases opened, C arrests, D charges, E convictions, F sentences, etc. And that's why justice may take a case from you when you're the U.S. attorney, because they just want the statistic. And that's not the right way to go about it. But if we focus just on the numbers, we lose the fact that all we're doing is measuring inputs versus outputs and not outcomes. And what we need to do is focus on outcomes. And the local people are more in touch with local conditions. They're probably much better at making that sort of judgment than in Washington.
If you suggested, and I believe it's true, that if adolescents don't use drugs, up until the age of 21, if you don't use drugs, it's unlikely that you're going to be involved in these higher grade drugs, the heroin and the fentanyl that we've talked about. On the state side, we have a number of states now advocating for the legalization of marijuana. And marijuana is a very dangerous drug long-term for the individual and for society at large. What can we do with at the state level, certainly, to prevent that from spreading?
Go ahead.
You're right. The argument in favor of marijuana legalization usually proceeds as follows. There are no reported cases of someone using marijuana and overdosing. Therefore, it's not a dangerous drug. And that is literally true, but entirely misleading. You don't have a large number of THC, which is the psychoactive ingredient of interest in marijuana, in the brainstem, in the component that deals with respiration. So you're not going to take a large amount of marijuana and therefore stop breathing. That happens with opiates and opioids, because there are a large number of those receptors in the brainstem. Marijuana, however, is more insidious. As you pointed out, use of that can lead to higher drugs. It's not a causation problem, it's a correlation, but it can happen. But it also, believe it or not, can also lead to mental disturbances like paranoia, schizophrenia, and the like. And part of the reason for that is the potency of marijuana is much greater today than it was in the 60s and 70s. I learned this last summer when I was at a seminar, and I learned it from a doctor by the name of Hoover Adger, who is the head of the pediatric medicine department at Johns Hopkins Medical School and Hospital. And he told me that the difference is so great that the old studies need to be re-examined. And there is a literature that I've been reading since then. In part because I've been writing about this. I just had an article come out yesterday entitled Marijuana Edibles and Gummy Bears, where I point out that not only do you have people smoking marijuana, it's being manufactured into all sorts of different types of food components, including things that look just like candy that kids will use. So yes, marijuana is a problem. Part of it is, I think, a public education need. That's part of the response. Part of the response has to be to say, that people need to know we're not dealing with granddaddy's ganja anymore. This is an entirely new type of marijuana. In fact, the oils that you can draw from it can be 95% THC. So it can be an extremely effective and therefore potentially dangerous form. You also need to come at it from an angle. A large number of people who are going to use marijuana are going to drive. And that creates a problem. Actually, one of the ways I got into the drug policy was because I saw people weren't talking about the effect that these legalization movements would have on highway safety. We've been very fortunate that since the 1960s, we've greatly decreased morbidity and mortality on the nation's highways through a variety of messages put forward not just by the National Highway Traffic Safety Administration, but through private parties, such as Candace Leitner, the woman who founded Mothers Against Drug Driving, who we had at Heritage on a panel back in March, I think, devoted to the problem of drugged driving. And we have a paper coming out soon on that very problem. No one wants to talk about that. Make people talk about it. Say, if you legalize marijuana, you're going to have this problem because they're having it in Colorado and in other states. What are you going to do about it? Why should innocent people be forced to bear that risk? Make them come up with an answer.
I just want to add something, too. I think that we also have a challenge that, because I just probably was on the same news report as the dog situation, that we're conflating legalizing recreational marijuana like Colorado versus the question of marijuana as a research question. Like, is there some sort of medicinal drug that could come out of it that would be regulated through the FDA, et cetera? My concern is because of the opioid crisis, and what I heard on the news was, well, this is why we need to have marijuana, because it can be an alternative to opioids. We have to be very careful that we separate these two discussions. Legalizing it for recreational is totally different than the NIH researching on what the benefits of marijuana might be. Totally different issues and need to be completely separated. And I'm very worried that the way that the narrative is coming out in the media and even in Washington, the opportunity is now within those that are advocating for legalizing it for recreational are going to now take that as their argument for why they need to legalize it recreationally. I think that's a very dangerous precedent. We need to be very careful that those discussions are separate on there. And just an anecdote on Colorado. I did hear some, it could be fake news, but that in some schools they have banned children bringing in their own lunches because of the exact point that you brought out. Because the school is paranoid about what is being laced in the food. Did they get a brownie that's actually laced with marijuana? Are those gummy bears legitimate gummy bears, or have they been laced with marijuana? This is, again, another cultural question. Are we going to be, you can't even allow your child to bring in their own food to eat at school. Yeah.
No, I agree 100% with everything. I made those points last week, I think it was. I testified before the Canadian Parliament, the Senate on International Affairs, on this sort of issue, and mentioned these points. You're going to have these problems. Gummy bears are going to now start coming in from Canada across the border and be distributed in the United States. And the best example of the fact that it makes sense to distinguish research from illicit use, Senator Orrin Hatch, who is by no means a fan of marijuana, for whom I worked and who I know, introduced a bill about 3 months ago trying to encourage research into the possible medical uses of cannabinoids, the substances in marijuana. He's not in favor of people toking up. He's in favor of research to try to find out if there's something that could be valuable to it. And that's perfectly legitimate.
And I think it's important, too, like you said, to research why, to learn if what the claims are being said are actually true. That's the other thing they've got to get to the bottom of. Right now, you're allowing the narrative to take over, like, oh, you hear football players saying, we used marijuana and I feel so much better, I'm so thankful, this is why we should legalize it. Maybe we need to have more rigorous research in the area.
Yes.
To see what the effects really are, the positive and the negative, and what outweighs.
Go ahead. I'm getting the steal sign from the people at Heritage. I just want you to know, I won't speak for Nina, but I think it's probably right. We're glad to answer more questions afterwards, but I think they've got you on a schedule, and they punish us severely if we get you behind. So I don't want to...
I'll be brief. Recently, two New Hampshire journalists did a story on the opioid pipeline that runs basically from South America, transiting through the Caribbean, going to Florida, New York, and then on to New England as well, which is decimating the youth population. I was wondering if you could address what's being done through that pipeline and how we're going to put some holes in it.
You can substitute opioids for cocaine, for marijuana. It's an X factor. There are people that want it, so there'll be other people trying to get it into the country. If what you're talking about is something like fentanyl, I believe that it was early thought that it was a difficult chemical to manufacture. Well, somebody decided to use some ingenuity and figured out an easier way to do it. The problem may be that eventually we're going to see people doing what they do with meth now. You go to a Motel 7, you don't know if the people in the room next to you aren't using it for a meth lab. Yeah, that's happening. The police are finding, they'll go in, they'll cook the meth, and then just leave, and sometimes blow up the room in the process. It can happen. So what you're talking about is a serious problem. But one of the ways we have to deal with this, I think, is persuade people to stop putting the stuff up their nose or using it in any other way. And that's worth doing. I mean, a life you save by giving somebody Narcan is a life that needed to be saved. If you keep somebody early on from using it, then maybe you don't have to worry about giving them Narcan later.
I want to add one more thing that I think that I found very interesting is the use of data. And how, if you were at the previous panel and folks were talking about the use of AI, artificial intelligence, and all this, I always look at these kinds of questions on technology. They can be used for good or bad, just similar like a gun. It can be used for good or for bad. So can technology. And in one area that data is really working is helping to identify where those traps are. I had heard on the ground that the state of New Hampshire is working with the other states, and they can track. The local law enforcement now has data that they can use to track where it's landing, so that they can go in and figure out how to eradicate, arrest the people, do the law enforcement side of it. So I'm very encouraged, too, with the use of data, and that's something else the government can be helpful in sharing that information, getting it in the hands so that we can, as the government is doing things, we're doing it with the right tools in hand. So whether you can use data of tracking people or where we need the overdose reversing the Narcans, rather than saying we're going to stockpile it in Washington and then we'll just distribute it to the states. Well, some states don't need all of that. But what we do need in a sophisticated system where you have companies like Amazon and all these other places where they can get you things from A to Z overnight, boy, if we could get the federal government using the data, working with private partners to make sure that we can leverage those tools to make a difference when it's the most efficient and effective way to get on the ground. I think that's something that's very, maybe a positive thing that's happening, is the use of data in trying to solve this problem.
All right, well, let's give them another round of applause.
Nicely done.
You did very well.
Thank you, Paul.